Yeah, what was that you're hanging out?
What was in y'all's email about just showing it's just for the S network, not the P.
Oh,
Y'all want that portion? It was in y'all's email.
no, that, thank you.
Do you want?
Sure. Okay.
I'd like to call the meeting of the Employee Benefit Committee to order at this time. Will you please call roll?
Councilmember Blevins,
Here.
Member Phillips,
Here.
Member Trevor. I know how to say your name, I think, maybe, but I do go try.
Here.
Member Claxton here. We'll have to talk about it after the meeting, so I'm not on camera, okay? Member Holloman here. Member Rachel here. I think so. Hart, right? Member Hart. And Member Smith.
Here.
I forgot yours, we'd be in trouble, right? And Councilmember Feldhouse. Councilmember Feldhouse did let me know that he would be here, but he is at home.
Okay, and as a point of information for everyone, Deputy Chief Smith will be assuming the regular voting member role on the committee. Welcome, Mayor. We're happy to have you, sir. With that, we do have quorum and able to conduct business. I'd like to hear a motion for approval of the agenda.
I'll make a motion.
Have a motion. Second.
I'll second.
Second. All in favor, say aye.
Aye.
Any opposed, nay? Motion approved. Now we have the approval of the minutes from the regular meeting of September 23rd, 2025. Carol, entertain motion.
So moved.
Have a motion. Do I hear a second?
I'll second.
Second. All in favor, say aye. Any opposed? Motion approved. Thank you. This time, is there any public comments? So you can vote. Okay, moving on into new business. We're going to ask the city recorder to discuss our future meeting schedule, as we do have upcoming meetings with all three providers.
We do, and they're all set for next week. Unfortunately, I was not able to get them all on the same day, but two will be held next Tuesday, October the 7th. The first one at 10 o'clock, and that's Blue Cross Blue Shield, who's our current provider. They're going to come and go over our current plan as well as provide options if we will want to change and stay with them. Also, October the 7th at 11, TML is going to come and give us a rundown of what their program is now. And then on Friday, October the 10th at 10 o'clock, Partners for Health, which is the state plan, will be here to go over their policies and what they offer. We will not have a meeting next Thursday due to having all three of these meetings. So then we'll get back the following Thursday to discuss our options at that time. I was trying to think if there's anything else, or if there was something.
Anybody have any questions or comments about next week's meeting schedule?
And we'll be meeting in here from now on. I'll send y'all all an updated invite when I get back.
There's no questions or comments. We'll move on to the general discussion of health insurance plans. And what we want to do with this is simply prepare for next week. Next week's going to be busy. We're going to have the representatives from each entity here. So, Kate, if you'll explain the sheet that you provided us, just in general, and then if there's any questions, we'll take it from there.
You're talking about this or?
Yes.
Okay. The reason I handed this out was, that's just me hedging, because I'm just letting you know, there could be a mistake on here, refer to the original documents, I don't think there is, but, and also I couldn't fit them all on here, it's only Network S, not Network P. And the costs are assuming the city continues to pay the 50% of the if people choose more than the individual. So there were a lot of assumptions that I wanted, that's why this page is here. And I know, Scott, if you don't mind, you had asked me to check on deadlines. Is it okay if I report on that? Okay. So I talked to the state and the lady that's actually coming next week. And it's a 60-day notice. In other words, if we wanted to start with them January 1st, we would need to let them know November 1st. Now, I did learn this that I didn't know. We can join at any point throughout the year. It doesn't have to be January 1st or wait till the next January 1st. So I also spoke with Brian Turner at Blue Cross to confirm what I thought I had understood, but I wanted to hear him say it. And so he said it in an email. They only require a 30-day notice if we're leaving them. So if the council chose to go to the state plan, we just got to make sure we give Blue Cross, our current people, a 30-day notice. So that's what I found out about notices. And I'm sure, the lady next Friday can elaborate on that if she needs to. As far as this sheet, I just, Henry had wanted me to try to combine all the state plans with our current plan, and so he didn't have to flip pages. So he asked me to do that, so I did it. Across the top there is just, obviously the first column is what we currently have. The other four going from most expensive to least expensive, left to right. These numbers are based on 210 employees being covered, which is what we have right now. That fluctuates month to month with people coming and going, but you got to pick a number. So if we went with, then these rates for the state are 2026 rates. If you went with Premier PPO, the state plan would be estimated to be $246,000 more. If you went with the standard at the state, it would be $37,000 more cost to the city than what we have now. If you went with the limited PPO, which I believe is what the county has, Bedford County, the city would save $416,000. And if you went with the local CDHP, which I honestly am not sure what that stands for, but it's got some health savings plans, and I just hadn't read up on that. Josh, you may be more familiar with that.
Yeah, that's a standard high deductible. We keep in an HSA for your medical expenses. It's basically you do that for tax purposes. You're paying for your medical stuff pre-tax.
So that would be $564,000 less. The benefits, we just kind of picked some highlighted benefits. It shows the deductibles, co-insurance. I'll just note, the first plan that's less than what we have is that limited, like the county has. Instead of it being 80-20, that would be 70-30. Emergency room and routine diagnostics are 70-30 instead of kind of fixed rates like over to the left there. Prescription drugs get a little complicated. I put the easy ones to explain at the bottom as far as the 30-day supply, but you get into specialty drugs and out-of-pocket maximums and all that, you probably just need to refer to that other schedule. On the second page, I tried to just break down. The first section is the city's annual cost per category, per employee. The second section is the employee's annual cost out of their pocket per employee. And the last is what it costs overall, city and employee. So if you look at that, it's kind of eye-opening there. The employee only is $96.51, but if you get up to the family, it's $29,275 per year cost overall. And I mean, all of them are over 20,000. So that's just some numbers I thought y'all might want. I'm not an insurance expert. I just tried to pull things from all the forms and put them on one sheet because Henry kind of wanted me to do that.
Which project are you?
Obviously, the majority of our employees have employee-only coverage. We have a few that have employee spouse, some have employee child, some have family. You know, a lot of people, husband and wife both work, so maybe they each have it at their own jobs, you know. Some places force you to, if your spouse can be covered under another plan. This was when I worked for private industry. You had to take it to the other place. You couldn't be on that one. So places have a lot of different rules on that. That's all I've got. I just tried to plug in numbers from the sheets.
And this information is information that was provided last week is to prepare us to be able to ask the questions next week. However, if anybody has anything at this time that they'd like to talk to the committee on, please feel free.
I will again. I wanted to clarify, because especially the way it was in the minutes last time, it wasn't clear what I still think, if I propose anything, which I don't know until we've had all our meetings, what I might propose. The minutes read like I was proposing employees pay the entire buy-up to whatever the upgrade was. I'm still proposing that we pay half of, that we still make our base plan the same as the county's, limited PPO. But we pay half of the buy-up, even on the employee only, which is not how you did it, Kay. Even on the employee only, I would charge the employee half of that buy-up. It ends up only being $18 a week out of their paycheck. I think what we're going to find is not everybody needs the 80/20. If you're even moderately healthy, you're never going to hit your out-of-pocket maximum. I think, you know, and I'm not super young, but I mean, I'm approaching 50. My wife and I, we've hit our out-of-pocket maximum on our insurance, I think, once in 10 years. So the 70/30, which is what your teachers and everybody in the county is on, it covers most people. So I think if we give people the option, maybe 25 or 30% of them may choose to pay for the buy-up. At the $18.12 a week, that's not a lot. And I think we still have enough money left over to do the 2% pay raise, which for most employees is going to cover that $18 a week. So it's not going to hurt anybody. I think the whole reason we're even looking at this is to put more money in employees' pockets instead of the insurance company's pocket. We're sitting on a Cadillac plan that's expensive for the city. If we can find a way to shift some of that money, give employees the option, if they want to buy up to the good plan, they can. If they don't need the good plan, I'd rather it be in their pocket than Blue Cross getting the money. So that would be and I did the math on that. If 100% of the employees chose to buy up and we did that half plan, we're still saving $140,000. Like I said, if none of them do, we're saving $400,000. I think we're going to end up somewhere in between there, and I'm hoping we end up more in the $250,000 to $300,000 savings, which would cover the 2% pay raise. It's about $320 if our math is still the same. We were about $160,000 per percent last year on pay raises. So, and I can show Kay my math afterwards to see where I was going with that. But obviously, we want to wait until we hear from the providers next week to see if we want to go in that direction. But if there's no feasible way to get there, we're not looking to cheap out on employees and take benefits away from people. We want employees taken care of. So if there's anything in this that's going to hurt the employees, we're staying where we're at. So
Yeah, we will have the minutes reflect that.
yeah.
I'm really interested to hear from the three providers, but I'll say that I represent the minority here, and that there's 56 people who are taking either employee, spouse, employee, child, or family, and I am among those 56. And every single one of these saves one of those 56 people money. every year over year. Where right now I'm paying $9,800 for insurance over the course of the year. And under the one you're talking about right now, that figure drops to $6,900, which is effectively a $3,000 raise.
That's without even
Realize
considering the 2% possibility.
Right.
Yeah.
That's not even with the 2%. I realize that that's not going to be the majority of people in the city, and I don't really want me getting a $3,000 raise based on the insurance to make my decision. So and I'm telling you, it's not going to. I want to do what's best for. I want to do what's really best for the 154, but I can't. I also want to be able to be true to the 56.
I know, that's what.
And there are 56 people here in the city that choose one of these other insurances, or that under our current insurance is paying more out of pocket every single month, every single week. And I want to.
Under all of these say PPOs with them, which is preferred provider network. Are they the same under each one of these groups, or are they, the limited PPO would be a smaller?
No, they're the same S group that we're currently under with our current plan. You can pay up to the, what is it, the P group, which gets you TriStar hospitals and stuff, but unless you live in Nashville, you probably wouldn't care about TriStar hospitals, but that is an option. That's part of the thing about the same plan. I read some of the regulations. If we offer one, you offer all to your employees. So they can buy anything that's on the same plan that they're willing to pay for. If they want to go all the way up to Premier PPO with the P plan, which covers TriStar, HCA, every hospital in Middle Tennessee, you can get that plan if you want it. There's probably not a doctor in Middle Tennessee that would turn you away with that plan. That's the top insurance plan available.
That would be an individual choice.
That would be an individual choice of the employee. Yeah, they would get that option at the time they signed up for insurance. If they want to be and they can even choose Cigna. You don't put Cigna up here, but there is Cigna as another option. Same thing. We can't limit the employees to a plan. They get a sign up. There's a website portal that they have. It's called Edison, I think. You go on the website and you pick your insurance plan right off that website, and you have access to all of them, all the state options.
Okay, I do have a question on that then.
Yeah.
If you're saying that if we're part of the state and I can buy up to the Premier PPO.
Yeah.
Right? How is that going to work because even the Premier PPO saves me $600 a year, right? But it's going to cost the city an additional $2,000.
Well, now that's what Kay and I will have to get together on. We don't have to give, I would only, and my proposal would be to only offer half of the buy-up to standard. I would ask that the employee have to pay for any buy-up to Premier. I don't think we can afford to cover that.
I wouldn't think so. Yeah.
No, that is going to cost the city a lot of money.
Yeah.
So you'll have the option, but it would cost you more than the sheet.
All right.
So yeah, it would be an option, but it would cost you additional. And actually, I've done the math on Premier. You're on the family, right? Mm-hmm. Yeah, the family, if we just cover the half buy-up to the standard, the family would be $11,700 per year.
Yeah, I'm not going to do that.
Yeah. But if you had somebody that was really sick and you hit your,
I get it. Yeah.
if you do the math, you may rather pay $11,700 Blue Cross than to pay, because they're covering 85% of your medical at that point, and I think your deductible's $750. So if you have a lot of medical expenses, you have that option to buy up to that. They could save you.
You're looking at the city, and if I've got you right here, you're looking at the city will do the for the family under the state limited PPO of 15,000. Anything above that, 15,006. Anything above that would be the employee's prerogative to buy it up to.
I would even propose we offer half of the buy-up to the standard PPO family plan, and that's to take care of the individual employees
that we're charging the buy-up to. I don't want to charge the full buy-up to the standard, because I want people that are already on 80/20, I want them to be able to stay on 80/20 if they want to, and it not hurt their wallet at the end of the week. So I don't want to, because that's our majority, that's our 154 people.
Yeah.
We got to do something to protect those 154.
Now, someone who is currently on the family, would you do the entire way up? And the reason why I'm asking is because right now the city's paying $19,463, but under the standard PPO, would only be paying $18,400. So would you, those folks that are under the family, would you go ahead and cover 100% of them since you're only saving $1,000 a year on those folks? Same thing for the employee child, actually.
I think I would still do half of the buy-up, just to keep it fair between the different plans, the same half to every. I don't think you want to pick and choose. I know you being on a family plan would like.
But it still saves the city money, that doesn't,
Right.
that doesn't compute, that doesn't math.
I mean, we could look at that. Kay and I could run the numbers on all that, so.
So,
Kay could run the numbers.
Yeah.
so if the 154 want to go higher, what do we do?
The 154, I'm saying cover half of them if they want to buy up to the standard PPO. Yeah, so cover half of that
So
buy-up.
employee only would start paying for part of it if they
Part
go
of
up.
it, yeah, that would be that would cost them $18 a week for that buy-up. Yeah. Yeah.
Scott, can I mention one more?
Yeah.
I just wanted to mention this, y'all may be aware of it, but I've only been back, I guess, 6 years now, but each year at renewal, Blue Cross comes and meets with staff, and they show what our claims were the last year, not people's names, but how our claims history was. And then they also bring different options. Hey, you can stay with what you got now. You know, that's why it came to council, it's a 5% increase. But they always bring 2 or 3 other options where you can cut benefits and it would be cheaper. But staff has always said, since I've been hearing it, no, we want to keep our good benefits, we don't want to cut benefits. So that's why they bring to council the current plan with like the 5% increase or whatever. So Blue Cross has been showing us other options that would maybe, I don't know, but I can't remember what they were for. I don't think they were 70/30, but it was, so there's been options they brought us. They just hadn't come each year and said, hey, we're raising you. We could have lowered our benefits and had lower rates.
Yeah, the only reason I'm considering doing this is just giving the employee the option if they want to take the lower and take the money in their pocket of that difference rather than we've made the decision for us
Sure,
in the past.
sure, I do.
Yeah.
Yeah.
Additional comments? If there's no further comments, I'll just, again, welcome Chief Smith to the committee. And also, please review the information that's been provided and then for next week. There's no further comments, I hear a motion to adjourn.
Motion adjourned.
I have a motion, second. Please adjourn.